Like I said, we have 2 offices as of April 1st, 2006. I had to rent a plane, hire a pilot to get recurrent. I hadn't flown for about 6 years, and that worked out pretty good until April 1st of 2007, and the pilot was causing me more stress than anything in my practice. The guy was always late. And one of our patients said, I think he lives down the block from us. We call him Lightning because he's always late. But the end result is, by God's grace and blessings, we were able to buy the plane December of 2007, and so I get to fly myself back and forth when the weather's good. One of our patients came in and said, what do you know about prolotherapy? And I said, well, I've had some training in that in 1987, but it's not covered by insurance. I don't take insurance. I can do that now. I'd completely forgotten about it. And we get so many patient referrals for prolotherapy. It happens all the time. And if you don't know anything about it and you want to ask about it, ask me sometime later on today. Raising fees. Well, we had a little dilemma. We looked at some of our supplies and realized we needed to raise our fees. We do a lot of IV therapies, and so I just put out a letter to our IV patients. We told them we could offer them the old price up until January 18th. And enough of them bought packages of IVs at the old price that we had a net profit for January of 2008 of $72,000. And then my final tax bill to get all that stuff that we started out with cleaned up was October of 2004. I was down in Phoenix at a meeting in September, and I was thinking, how in the heck am I going to come up with that $34,000? So I made my patients another offer, and enough of them bought packages over the next 2 weeks that I had $45,000 to pay my taxes rather than $34,000. So it worked out pretty good. You see things in the media, and in May of 2008 there was an article talking about these patient direct practices, and they said the income was modest. Did you think there was anything modest about that income I showed you? We can live on that. My wife and I can get by. And then they talked about another thing. You'd have to give up hospital rounding. Oh, really? I don't miss it. Here's another one from 2008, and they're talking about the physician pay cut of 15% of that year. What are we talking about now? 21% pay cut the end of this month. And my question is, are doctors enduring death by 1,000 cuts? And here's a quote from Angela Braley of WellPoint. She's talking. They ask her the question, are you concerned about losing customers when you raise your premiums? And she said, we will not sacrifice profitability for membership. That was nice, wasn't it? Preparing for a Medicare fee cut. Well, that was May of 2008, and here we are again talking about the same thing. This article talked about you have several options. One is to opt out. And the other options they listed are not worth talking about. So what is the only option? Opt out. Get out of the system so that you can be the doctor and take care of your patients. Well, we hear about these InStore Clinics. These are great, just like Catherine was saying. People go in there and they get used to paying cash at the time of service, and in Wichita the fee is $59. And they see a nurse practitioner who gives them several prescriptions to be filled in that drugstore, and if they go to an insurance-based doctor, the minimum they're going to pay is $75, so that makes a $40 office visit with us pretty reasonable. Solving the healthcare crisis. We could solve the healthcare crisis. If enough doctors would opt out of Medicare, quit the insurance plans, we could bring the insurance companies and the bureaucrats to their knees. And if the insurance became catastrophic only, as Ralph was talking about, where you have a plan that pays if certain things happen, we'd be so much better off. The patients would be so much better off. Most important thing is we can't say what the other people are going to do, but you can be ready for the recession. And of course, I wrote this particular slide a year or two ago. The recession is on us. And this is the way to be ready to take care of more people. Thank you.